All right, so if you all can press yes, we can get started. So what I like to do first is I like to let's look, folks are getting vaccines. Some folks are getting through COVID. We want you to use the chat. We want to know, what activity do you hope to engage in once this pandemic is over with your family? Dinner parties. Yes, travel. Mine is definitely vacations. I miss my vacations. Okay, we got a lot of travelers. Reconnecting with family. I will tell you all, I got my first shot on Monday, and my husband is already wanting to look at going on vacation. For me, it's a bit early. It's a bit early. Just getting out the house, yes. Late graduation parties, yeah. We missed a lot of birthdays, a lot of weddings. Some of us, unfortunately, missed a lot of kind of funerals. I know that some people have been holding those over too. And then just some of those fun things, just connecting with family and celebrating a 50th anniversary. Congratulations. So we know that we have a lot of events that we've postponed, and we know that there have been some needs that we have had just outside of our family that we need to really take care of. So as I said before, this time with you, you are going to get a lot of resources today. We have chunked them into different areas. You have your resource sheet in our minds. You have that sheet printed out. You're going to be making circles and stars and writing notes on there around those organizations that you think might be helpful to you. And so let's go ahead and let's get started. So our mission at the Statewide Family Engagement Center is that we understand that every child has a team that supports their successful launch. We see getting our kiddos into school and out of school into career, college, or just out to life, like we look at a rocket launching. There are several roles that are played in the launching of this rocket. It's families, schools, and communities. And so, as I said earlier, we've talked about that school piece. Now we're going to talk about that community piece that we need to kind of get shored up so that we can make sure all the kiddos that you are caring for will have the best launch possible. We also know that many times the lack of resources causes a barrier for us to be fully engaged in our educational experiences with our kiddos. And so we want to alleviate some of that today by just really giving you this major kind of dump of potential resources that you can use. So we're going to cover them in 5 major areas: just supports, childcare, medical resources you might be eligible for, food resources, and then financial resources.
You want more broccoli?
And then Beth, you can skip that. So then let's talk about kind of the new Grandfamily or Kinship Caregiver supports that might be available to you. This list is not exhaustive, but we're going to talk a little bit about Connect Ohio, the OFCA, grandfamilies.org, which is a wonderful organization that we leverage a lot of our resources from, the Children's Defense Fund, and the Ohio Children's Alliance. So let's just start talking about the Connect Ohio program. So the Connect Ohio program is a short-term intervention program that spans across 16 counties in Ohio. And it focuses its efforts on increasing the number of children who are placed with relatives, ensuring a natural and community support. And it also promotes stability for the children by connecting them with all members of their family or their community who are connected to the child and interacting with them in order to provide supports. So the types of things that you can expect from Connect Ohio are services related to babysitting, community activities, companionship, emotional support, and we all need that, information around housing, even mentorship. Some of our families engage in respite care where we just kind of need to maybe send the kiddos in our care off to another responsible adult for various reasons, just a break or things that we need to take care of. So there's respite care, but then also transportation. And you can see right now, as of the time that we collected this information, these are the 16 counties that has this type of program. So if you see your county in there, chances are you'll be able to get access to these services. Next slide, please. So our next organization is the Ohio Family Care Association. That's another support for grandfamilies in Ohio. So this support comes in the form of directing kinship caregivers to resources and family supports. They have supports, for example, called a warm line. And so they give out non-emergent information on that warm line. They focus particularly on advocacy and community awareness on kinship care topics. And you can see all the different things that they also do as well with the OFCA. One of my favorite resources is grandfamilies.org. I have personally met with one of the leaders at grandfamilies.org. They're constantly updating their information on their website. So they have a lot of reading material and resources on laws that are specific to kinship caregivers, fact sheets based on your state. So you can find out how many kinship or grandparent caregivers are actually in your state. They provide information on housing and education and financial assistance regarding anything related to kinship caregiving. You can go to their website and they actually have headers on a variety of topics that will lead to any assistance that you might be able to gain from that resource. Now, a big part of the resources are the fact sheets, they are the laws. So you might start thinking about kind of what are the state laws that might affect your situation. And some of those will be embedded in those fact sheets. And some of the state laws will actually be embedded in some of the resources that we share today as well. So the Children's Defense Fund. That is a fund. It's another organization that focuses its work on advocacy. So when state or national laws are created that affect kinship caregivers or children, whether for or against, they are there to advocate for families, and they have the best interests of the children in Ohio in mind. They also have some programs like the Beat the Odds Scholarship, which we'll talk later about. They have the Children's Sabbath celebration, and that aims to really bring multiple communities of families of all different religions together to celebrate. And then finally in Cleveland, there is a youth-run advocacy group that they really teach young people how to advocate and change laws. And that's the New Abolitionist Association on the bottom. Now, some of these are not specific to kinship caregivers, but these are definitely some organizations that focus their work on issues that are related to kinship caregiving. And so those were the resources that we have curated related kind of to if you were just kind of beginning to start your new kinship caregiving role, or if you are in a newly formed grand family. So the next thing is childcare. We all know just if you just are in a traditional family, childcare is always kind of a interesting situation to find yourself in. And so we really wanted to spend a little bit of our time curating some resources that might assist you with that as well. And so we're going to talk about childcare subsidy, childcare in Ohio, the Ohio After School Network, and then searching for childcare facilities. So just to note, you may not need childcare right now, but it's possible that you will need it later on, or you will know someone who could also benefit from this information. So we just wanted to share that with you. So childcare in Ohio is run through the Ohio Department of Job and Family Services. I'm sure some of you are familiar with them if you are in a more formalized grand family or kinship caregiver situation. This resource helps give caregivers who work pay for childcare. Now, the program is publicly funded childcare, and while all the childcare payment will be covered for other instances, you may have a partial payment associated with the childcare. This is very much dependent on your income. And so you can apply online, or you can print off the application and actually mail it in. And you can see we have the website on there. Beth, can you advance to the next slide? We have their website on there, but of course you also have it in your resource kind of sheet. So if you're a paper person like myself, then you can print it off and pull out your postage stamps, which I sadly still use postage stamps, and mail that application in. And hopefully you will get connected with that service if you need that type of situation. So then the next one is I want to talk about the Ohio After School Network. So the Ohio After School Network provides a few important resources, including advocacy with state lawmakers on the importance of after-school programs in Ohio. Because we've been impacted by COVID, this may not be a resource currently available to some of you, but I definitely would keep it on my list if you have children that fall under the category that would need childcare. They also connect caregivers like yourself to after-school and summer learning programs. And there are 3 programs that they provide a connection to. So the Ohio Department of Juvenile, the acronym is late at night, I can't get it, but ODJFS is a licensed program, and it runs through the Ohio Department of Job and Family Services. There you go. They are responsible for licensing after school and school age childcare programs operated by child care centers, child day camps, type A and B. And just for your understanding, type A is a child care that allows 7 to 12 children in that place. And then a type B is more of a home provider who can care for no more than 6 children at a time. There's also some age limits that also impact that as well. The Ohio Licensed After School and Child Care Program, the SAC, runs through the Ohio Department of Education. Now they're responsible for licensing school-age childcare. So that's 5 years to 14 years of age. Those programs are operated by public schools, educational service centers. So those are your ESCs, you might know them in that terminology. Community schools, so those might be some of your charter schools, boards of developmental disability, and then, of course, the chartered non-public schools, as I said before. And they cover multiple grades above kindergarten. And then the 21st century programs. Those are the Century Community Learning Centers. They are a federally funded after-school program that provides opportunities for children who come from economically disadvantaged families and who also attend low-performing schools to receive academic supports and those types of things. Schools, districts, and community-based organizations, including faith-based organizations. So we could see some of these housed in churches. Also institutions of higher education, city and county government agencies for nonprofit corporations and other public and private entities can host these programs. We've had some connections with the 21st Century Learning Centers at Ohio State. And so we know them to be really good programs for childcare related things pertaining to after school care. And then if you're looking for childcare facilities, so there is Action for Children. I personally, in my personal and professional experience, have found Action for Children to be a great resource related to making connections to childcare and those types of things. Some of the services that they provide are free, and you can see their information on here. If you have a family that is Spanish speaking or needs services that are provided in Spanish, they can also accommodate that. The Children's Advocacy Project of Columbus, CAP for Kids, as a school psychology student, this was one of our go-to resources that we shared with families. And they have a host of child care related resources. They have information around summer programs. They have some information around, sometimes they'll have information around respite care and those types of things. OCRA, the Ohio Child Resource and Referral Association, we are very familiar with this organization at Ohio State as well. You can go there and find information about kind of what they have to offer. There's a lot of information around preschool age kind of information if you want to do there. And then of course, there's the Ohio Child Care Finder, where you can go in there and just kind of put in your information and see what you can get connected to. So those are the child care resources. Then we wanted to give you some information around education resources. I know we talked about.
Then we wanted to give you some information around education resources.
Pearl, are you? Oh, she's muting. Okay. So we know that we talked about kind of connecting with educators our last session, But this particular portion of this really is going to talk about just some resources outside of schools. Now, this one also is not going to be kinship caregiver or grand family specific, but definitely if you have school-aged children, this might be some resources that may be helpful for you to know, and perhaps even some resources that you may not come across just in the general education experience. So we wanted to make sure that we at least gave you some information around that. We're going to talk about Head Start, one of my favorites. I worked for a Head Start for 5 years doing evaluations. The Ohio Imagination Library, I'm super geeked about this. Ohio Reach and Beat the Odds Scholarship and Children's Defense Fund. We talked about that earlier, and I promised that we would go back to that. So we will review that as well. So Head Start. Head Start, if you don't know their history, they came out, decades ago. It is a federally funded school readiness program for children from prenatal to birth. So you can also have early Head Start. Head Start provides services to eligible children and families in the areas of early learning, health, family well-being, while engaging parents and guardians or kinship caregivers or grandparent caregivers as partners every step of the way. Head Start includes preschool programs that service children 3 to 5 years old, and early Head Start programs are for infants, toddlers, and pregnant women. So the early learning component of Head Start looks at using relationships with adults, play, planned and spontaneous instruction. They believe that children grow in many aspects of development. Children progress in social emotional skills in Head Start and their emotional well-being, along with kind of increasing their language and literacy learning and concept development. So basically, Head Start allows our very, very young learners to begin understanding how to learn, how to form language, those types of things. The health component is that all children receive health and developmental screenings. I was kind of a part of that process. They get very nutritious meals. I've been a part of having to eat in Head Starts where I didn't necessarily want to eat, but as the adult in the room, I ate the healthy meals anyway. So they get those healthy meals. They do get oral health care. The kiddos are in the Head Start brushing their teeth. They get dental screenings as well. They get a lot of social emotional support. They're learning how to be with others when they're in Head Start. These programs can also help you make connections to additional medical, dental, and mental health services as well to ensure that your children are receiving the services that they need. Then thinking about family well-being. These programs often support and strengthen parent, caregiver, guardian, and child relationships, and they also engage families around the children's learning and development. Let me tell you a little bit about eligibility, because I think it's very important that we understand that these resources are not helpful if you don't know if you're eligible for them. So with Head Start, it is based on a family's income, and it has to be at or below the level according to the federal government poverty guidelines. So children in foster care, children experiencing homelessness, and children from families receiving public assistance. So those are those Tanf funds, and we'll talk about those later on, and SSI, generally are eligible regardless of their income. You can call or email to get assistance. You can also look at their website, and they have a tool that you can use to locate some things as well. Oh, thank you, Marion. Wonderful. So if I misstate anything, please feel free to correct me in the chat. Okay. And so then we're going to move on to the Ohio Governor's Imagination Library. Let me tell you, I love little ones when they get to listen to words being read to them, even when they're like fresh out of the package. And so I was very excited to learn about the Ohio Governor's Imagination Library. So it was created to emulate Dolly Parton's Imagination Library. This program is free to all Ohio families, and it runs through all 88 counties in Ohio. Caregivers can enroll children from birth to age 5 into this program. You will receive a free book in the mail every month, and this will help promote learning. You can enroll online. It'll take about 6 to 8 weeks for you to receive your first book. And on the child's 5th birthday, they'll receive their final book. If you have a child in your care who's under 5 years old, you can apply for this at any time. And when you go to the website, you will enter the child's information, not yours, the child's information. And then you verify your address. Eligibility will be verified, and then the caregiver information will also be entered. And I think this is just a wonderful resource. Literacy is great to kind of start that exposure fairly early. And even though these little ones can't touch and feel these books, listening to someone read is helpful to their language development. Thank you for putting the guidelines in there for the poverty guidelines, Roxanne. All right, we're going to go to REACH. So this is a new statewide program that supports Ohio's foster youth as they pursue their college education. The Ohio REACH program was recently established by Ohio Department of Higher Education, ODHE, some people know them that way. They created this to carry forward a decades-long initiative. ODHE is partnering with the Ohio Children's Alliance to manage this program. So Ohio REACH, what they essentially do is they provide supportive services to colleges, mentoring programs for selected students, and an emergency fund to help students who need to overcome short-term crises like securing housing during school breaks. So this program might be more beneficial for some of your older kiddos who might be transitioning out of the house and those types of things. And then I promised 2 times now to talk about the Children's Defense Fund's Beat the Odds. So this is a scholarship program that honors outstanding high school students. So if you have a high school freshman, junior, sophomore, senior, I've got a rising senior in my house, this may be a resource for you. So it honors the kiddos who have overcome tremendous adversity. And they have also would have had to demonstrate academic commitment and giving back to their communities. Those are the 3 major criteria for that. Overcome some odds, made a commitment to their academics, and given back to their community. So every other year, the Children's Defense Fund provides $5,000 in college scholarships, a laptop computer, and an initiative to join the Children's Defense Fund Youth Leadership Development Program. And it is available for high school seniors in the state of Ohio. So we have gone through the educational things. So now let's talk about some of those medical resources, because we know that sometimes our kiddos get sick, they need medical care. Sometimes we don't know how to locate them. Sometimes there's barriers because we are in this new kind of forming kinship and Grandfamily. So we are going to talk about connecting kids with care, Medicaid, the CHIP program, the Healthy Start and Healthy Families program, Help Me Grow, one of my favorites, and the WIC program, the Women, Infants, and Children program. So the Connecting with Kids program is a program that's run through the Ohio Children's Alliance, and it provides access to comprehensive behavioral health care that is timely, effective, and offered in convenient locations. The Ohio Alliance launched the Connecting with Kids Care, CKC program in 2020. And their goals are this: to provide telehealth. And so that just enhances the ability of the community behavioral providers to deliver behavioral health care through telehealth means. So that means that your kiddo will not have to go into a facility to receive some of those mental health services, that it can be done over the phone, and in some instances, potentially over the computer. We're all accustomed to doing things on Zoom and Google Hangouts and all the different platforms. So this would fall under a telehealth service. And then they also provide same-day access. So they have trained behavioral health providers to establish a capacity to serve patients who have initial mental health assessment needs the same day that they need the service without getting an appointment. So if you have one of your kiddos that are in a mental health crisis and you feel like you need to get some services, this is a program you may want to consider. Also, hospital follow-up care. We know that some of our kiddos are going to be receiving services as an inpatient, but also when they leave that inpatient care, they have some additional mental health needs that need to be addressed. This program will allow them to continue making connections once they leave a facility. They'll allow them to, at discharge, to get connected to another provider within their community. The program is supported by Aetna, Molina Healthcare, and United Healthcare. And I have put on Lori Stadmiller's information. She is the contact person that we were able to locate. So if you think you might need these services currently, or in the future, I would strongly suggest that you keep that information. And so the CHIP program is the Children's Health Insurance Program. It is low cost healthcare coverage for children and families that earn too much money to qualify for Medicaid. CHIP covers uninsured children up to the age of 19 in families with income up to 206% of the federal poverty level. And I did some digging because I thought this is not helpful information for us unless we understand it. So here are a couple examples of income that would get you close to qualifying for this. For a family of two, so if you're a kinship caregiver or a grandparent caregiver and you just have one kiddo, around $38,000 may get you eligible for these services. If you're in a family of three, then it's around $43,000 a year of your income that may get you eligible to get these services. If you are in a family of four, if you make around $52,000 a year, you may qualify for these services. These services, the CHIP benefits are based on your state. So if you go to a different state, the qualifications may change. But regardless of the state, they should be comprehensive coverage for anyone who qualifies for it. And they also provide free well child doctor and dental visits. So those annual visits that we need to make sure our kiddos are progressing physically well and that their dental needs are taken care of are also covered under this as well. So Healthy Start and Healthy Families it's another Medicaid covered program. Eligibility for this program is based on the child's income. So eligibility for this program is for children up to the age of 19, and the income level can be up to 156% of the federal poverty level. So if you kind of think about what I talked about before, the other one was 106, and it was 206, and it was for $38,000 for a family of two. This one is a little bit lower, and it's just for the child. So I would highly recommend looking on this website to ensure the child's eligibility. But in general, if your kiddo is eligible, they can get coverage for doctor visits, hospital care, and we know that that is extremely expensive. Vision, so if your kiddo is someone that needs glasses, that can be very expensive. The exams and the glasses and the frames can be very expensive. Dental and mental health services as well could also be covered. What do they consider the child's income? Good question. Is potentially any income that the child gets as a result of a variety of things. I'm not sure if it's like SSI or something like that. Good question, Amanda, but I would definitely check the website on how they determine the child's income. It could be zero. So it just depends on the financial resources that are coming into the house that are identified to be specific to the child. Good question, though. All right, so let's look at Help Me Grow. I love Help Me Grow. They do a lot of stuff. There's a lot of people that use Help Me Grow. They provide wonderful services. Their goal essentially is to help improve maternal and child health, to prevent child abuse and neglect, to encourage positive parenting, and to promote child development and school readiness. And generally, a mother who is expecting can enroll in Help Me Grow. And then once you have the kiddo, they can also be enrolled in Help Me Grow. The early intervention are for our kiddos who have developmental delays or disabilities. This would mean that that particular kiddo would have to have some type of diagnosis that a physician or a practitioner would say, this child is experiencing a developmental delay. Let me give you an example of that. We think about those things that our children do at a typical age period. So walking, talking, those types of things, right? So if we have maybe a 2-year-old who has not produced speech like they should, that kiddo could be identified as having a developmental delay, potentially. That might be a kiddo that will qualify for this. And what they do is they develop a plan called an Individualized Family Service Plan. We call them IFSPs. And then they engage in home visits and all those types of things. And I will tell you, as a school psychologist, I was a part of some of this with some of my preschool families. And what's nice about it is that you can have conversations with the school district that's receiving the kiddo if they have an IFSP, and that can then be used to start talking about school-based IEP services. So Lindsay, let me see what you're saying here. They don't have to have a diagnosis. Okay. Yep. Thank you, Lindsay. I appreciate that. And then WIC, Women, Infants, and Children Program. That is administered through the Ohio Department of Health, and it provides food, nutritious food, information about nutritious food, information for mothers who are nursing their kiddos. It also helps eligible families find a family doctor. So if you have not identified a physician for your family, WIC helps with that. And other services that could essentially keep the kiddos in the family healthy. Children from birth to age 5 qualify for WIC, and families must meet WIC's program, medical, or nutritional risk guidelines. And let me explain to you what those are. You've got to be a resident of Ohio. There has to be a medical or nutritional risk determined by a medical professional. So someone has to say there's a risk in terms of medical or nutritional needs. And then you have to meet the federal poverty level where your income is around 185% of the federal poverty level. So you can see a lot of these programs require a specific amount of income that starts your eligibility. So it's a really good idea if you are thinking about looking at these resources to really go on their website and check and make sure that your income matches that eligibility. Food resources outside of just WIC, because sometimes we have food needs. So we're going to talk about WIC a little bit. We'll talk about the Supplemental Nutrition Assistance Program. We know that as SNAP. And then the Ohio Department of Job and Family Services Emergency Food Assistance Program as well. Thank you, Betty. You guys are active in the chat. I appreciate that. I'm all for making sure we have correct information. So as I said before, I explained what the WIC program was in terms of being eligible for it. So what you can do is you can print out, they have a health history form that's listed. You can print that out for each person that you would be applying for WIC. And I would say be sure that the form best describes the person. It's the infant, a child, and then make sure you specify which one of those individuals you're applying for or all. And what's nice about it is WIC will help you make sure you receive those health and nutritional services that we talked about that are really individualized based on you and your family's needs. They also have a Wic Pre-Screening Tool. I think I have it here, actually here, I don't know. I'm going to actually drop this in the chat because I want to make sure you have access to this. I'm not sure if this is in the resources. So I will drop that in the chat in a minute. And then we'll go on to SNAP. So SNAP is based on the household size. You have to think about how many people live in and that you buy or make food for. And then you have to think about income, how much money your household makes. This includes both your earned income, so the money you make from jobs, or your unearned income, so the cash assistance, Social Security, unemployment insurance, and child support. So let's talk about who might count as a family member in your household. Anyone you live with and you buy or make food with counts as a member of your household. So you may live with people who don't count as a household member, like tenants who are renting a room, or an adult child, that's over the age of 22. Children under the age of 22 generally always counts as a household member, even if they make or buy their own food. My children make or buy their own food and they're under 22. 60 or older, and folks that have a disability can also count in this. And so you can get like the food stamps portion if you are unemployed, as long as you aren't leaving a job or reducing your hours specifically so that you'll qualify. So they don't want people kind of leaving their jobs and doing different things so they can meet the qualifications, even though we know sometimes that's very difficult because sometimes you find yourself right there and your income is just not enough. You may also be required, if you do get SNAP benefits, to participate in employment or training programs if you aren't working or if you work fewer than 30 hours a week, but there are some exceptions that they have. Since March, I don't know if any of you know this or not, some states have been using temporary SNAP funds very flexibly to provide emergency benefit and supplements and maintain benefits to households with children missing school meals and to ease program administration during the pandemic. So they were a bit flexible with kind of the way that they were giving out some of their funds because they recognize that some of our kiddos were not getting the breakfasts and the school lunches that they would typically get. And so families were getting some SNAP benefits as a result of that. And then we look at the Emergency Food Assistance Program. That is a federal program that helps supplement the diets of low-income Americans by providing them with emergency food assistance at no cost. The USDA provides 100% of American-grown USDA food and administration funds to operate this program. So the foods are prepared meals and they're distributed through public and private nonprofit organizations that provide nutrition assistance to low-income families. So your eligibility criteria are on the organizations that distribute the food. So it's a lot of organizations that distribute that. You can look at their eligibility. But when you apply, it's income standards set by the state and kind of different information that we have on the slides as well. And then you can also see some of the food that they provide if you qualify for those resources. And our second to last resource are some of the financial resources. So we're going to talk about Tanf, we're going to talk about SSI, and many of you probably are much well versed than I am in this. So please feel free to add to the conversation. The Kinship Permanency Incentive Program, Adoption Subsidies, and then HEAP. So TANF, the Temporary Assistance for Needy Families, is a cash assistance program that is based on income through the Ohio Works First. You can use the benefit for a maximum of 36 months, but you could receive an extension for a hardship extension or for good cause extension. Children in the home that receive these services must be 18 years or younger, or 19 if they're a full-time student. Eligibility includes minors who are living with a guardian other than their parents and may be eligible for child-only assistance with no time limit. But a couple things you should be prepared for if you're going to consider applying for this. Generally, you have to provide proof of citizenship. You want to have Social Security cards available, birth certificates, proof of income. So that might be employment documents, child support, disability, unemployment, those types of things. And there might be some additional verification that they may request for these funds as well. So if a member works or pays for childcare, the cost of childcare may be deducted when determining eligibility. But you got to complete all the documented work activities with the set number of hours per month, all those different things. If you want more information about this, you can apply at benefits.ohio.gov, or you can submit a paper application. So if you do qualify for benefits and you actually get them, they'll be issued either through an Ohio Pathway card, which is a prepaid kind of debit MasterCard, or they'll be deposited directly into a checking or savings account. The Ohio Pathway card, if you do receive that, can be used as a MasterCard with banks, ATMs, and any retailers that accepts MasterCard. And I don't know of any that no longer accept those. So then let's talk about SSI. So to be a dependent for SSI on the worker or a grandchild or step grandchild, here are the qualifications. The person must have begun living with the worker before the grandchild became 18 years old. They must have lived with the worker in the US and received at least 1/2 support from the worker. So if you're the worker, your grandchild, if you want to get these benefits, would have to have lived with you before they turned 18. The year before the month that the worker became entitled to the retirement or disability insurance benefits or died, that is very important to qualifying for these too. So your grandchild may qualify for the benefits based on your work records. The Supplemental Security Income Program pays benefits to adults who have disabilities and children who have limited income resources. SSI benefits are also payable to people 65 and older without disabilities who meet certain financial limits. So there's a lot to unpack with SSI. I know a lot of people who get the financial benefits. I have a sister who actually gets financial benefits, and it's been a lifesaver for her in just taking care of her basic needs. And then thinking about the Kinship Permanency Incentive Program. So this program was created to support children in the homes of family or friends who have committed to caring for them when birth parents cannot. And this is many of you. It provides time-limited incentive payments to families caring for essentially their kin. So eligible kinship caregivers will receive an initial payment to kind of cut down the cost of the initial placement of the child or children. And you could receive additional payments at 6-month intervals, so one every 6 months, to support maintaining a stability placement for the children in your care. Now, the maximum incentive amount cannot exceed 8 months, and it will not be provided for longer than 48 consecutive months. The KPI payments are in addition to the Ohio Works First cash assistance received for the child. I think I was in one of the meetings before where they talked about some of the payments. Sometimes you can overlap some of these kind of social financial payments, and sometimes you cannot. In order to receive this, the court must have awarded legal custody or guardianship of the child on or after July 1st of 2005 to the kinship caregiver, and it would have been based on the best interest of the child. So the Public Children's Services Agency must have completed a relative or non-relative substitute placement approval process. So there is a process you'd go through. That would be including a background check, those different things. They're going to look at the gross income of the caregiver, including the child, and it may not exceed 300% of the federal poverty level. There are kinship permanency incentive programs should be in every county agency. And so if you're not in Franklin County where we are, you should be able to gain access to information with this based on your county. And we have the link that you can follow to look up that. And then adoption subsidies from Job and Family Services. So the Adoption Assistance and Child Welfare Act was passed in the 1980s. That's been a long time ago. There's been kinship caregivers and grandfamilies for a long time. And they passed this because they wanted to give children with special needs a fair chance at being adopted. This law made it possible for families to receive subsidies and medical assistance to adopt children who have had some of the hardest time finding placements. And you can see the different types of subsidies that are available. You can get the adoption assistance, the adoption assistance connection, the non-reoccurring adoption expenses subsidy, and then the state adoption subsidy. And I don't want to go too far into detail, but you definitely can use the link that we have in the resource sheet to look further in this if you believe that you qualify for that, if you just want to explore that a little bit more. And then the Home Energy Assistance Program, we call it HEAP. It's a federally funded program that provides eligible Ohioans with assistance with their home energy bills. I know this came in handy a lot during COVID, especially in the winter months for many of our families. This is not just a kinship caregiver or grandfamily specific program. This is a program for individuals who need this type of assistance. Generally, it's a one-time benefit that's going to be applied directly to your utility bill, your gas or electricity bill. And it should help kind of offset any type of situations that you're having where you cannot meet paying those particular bills. And you can see some of the information that you would need if you're going to apply for that program. And our last topic is just Liaison and Advocates. We have some of them on here. I saw someone from one of the agencies on here. So if I misspeak, unmute yourself and correct me, please. So our state representatives, I don't know if you all know, but we have some state representatives that can do some phenomenal things for us and our families. So each state and federal agency has a liaison assigned to assist Ohioans when they need help. That's what our representatives are there for. You can contact your state rep for your district to request help for slow moving applications or when you feel you need help. I know a lot of people actually do contact their state representatives about a variety of things. A good state representative's office will create a request for you and they'll contact the liaison on your behalf. And they'll send any questions related to federal programs like SSI to your congressperson's office for you. And they may request a form to be completed with personal information on your behalf. Any statewide program can be handled by your state representative or state senator. So if you're having issues with some of those programs or making connections with those programs that we shared, potentially reach out to your rep. Representatives and senators also have connections with local programs. We know a couple of them at OSU, and they are very well connected. So please feel free to contact them if you need any assistance with any of those programs, and they might be able to provide you with some. Just so that you know, there are 88 representatives in the state of Ohio, and you can find yours by using the Who Represents bar at the ohiohouse.gov website. And then there's 33 state senators in Ohio, and you can find your senators at ohiosenate.gov. And there's usually a local office in larger cities for those of us who are in those cities, and we can actually go and visit there. Now let's move on to the Ohio Kinship Adoption and Navigator program. And I think I saw a rep on here for this program, so please feel free to speak up. This program provides statewide support for children, youth, and families. It is a free program, and you can see all the different things that they provide. I will tell you personally, I have been engaged with a lot of preschool providers and kinship caregivers of preschoolers, and I have heard personally, word of mouth, that this is a phenomenal program, and it comes in very, very handy for grandparent caregivers as they're navigating this whole child care, little people landscape. So I can speak personally about the benefit of this program to many of our families in Ohio. And then the Public Children's Services Association of Ohio. They are also another kinship caregiver advocacy program. They engage in a lot of legislation statewide and federally. They have some facts books and different publications and different resources related to kinship caregiving. There's also some information on legal things related to kinship caregiving, and you can go to their website and find additional information there. And then the Ohio Grandparent and Kinship Coalition. I've had the great pleasure of attending some of their meetings. Angela got me into the door. And so they provide so much information for kinship caregivers. We have leveraged a lot of their information in some of the work that we do. And so they have meetings, they have content on their website, they have connections, and they're very, very involved and passionate about kinship caregivers and providing them with the services that they need. Thank you, Barb.
Yeah, and I have to say they helped me start the support group. So give credit where it's due. They're amazing.
There you have it. There you have it. And so then we'll go on to the Ohio Foster Adoption and Kinship Care. So they provide information on kinship care versus foster care. They can give you resources that explores rights and responsibilities of kinship caregivers, and then resources around a lot of the things that we just talked about: childcare assistance, housing, financial, and those types of things. We try to pull a lot of their logos so that when you look at these slides, you will know if you're on the right website, if you have the right logo. So we tried to really make sure we had the right one so that it was visually, that you could visually remember. And then AARP. AARP has some wonderful resources. They are not just around retired folks. They understand that some retired people are also caregivers right now. And so they have amazing resources on their websites that could also support kinship caregivers and grandfamilies. We have also used a lot of their resources as well in our work. And many of the topics that we covered, you can find information on their website as well for those resources. The Ohio Department of Aging. So as we said before, so we know in our research that most of our kinship caregivers are not retired folks. They're not older folks. They're kind of people like in their 40s and 50s. However, we do know that there are some kinship caregivers or grandparent caregivers who are retired, who are older. And so the Ohio Department of Aging also has some supports there as well for folks who are taking care of their families outside of just taking care of a kinship caregiver. If you just need some support in different ways, you have that from the Ohio Department of Aging as well. And they can help you locate some legal documents and different supports as well regarding grandparent or kinship caregiving. The Central Ohio Area Office of Aging, we put the counties in here that has some of these offices. So you'll see there's some really good coverage here in Ohio. They have, same thing, resources on respite, daycare, educational things, medical needs, that you can make contact with them. I will tell you, I've made some contact on behalf of a relative to many of these agencies. They are extremely helpful. They have case managers that work through processes with you. Sometimes we'll get contacts if someone has been discharged from a hospital to make sure that care continues in some of these things. So I would highly recommend looking at using some of these resources. The Ohio Children's Alliance, we talked about them earlier and some of the things that they do. And so we have kind of their stuff on there too with their logo. So if you wanted to go there and look at specifically some of those mental health services I mentioned earlier, you have some of their contact information as well. You may not know this, but you have been provided with about 50 slides of information, and it has been a literal information dump. So this is what we want to do now. We want to figure out, what are you going to do with this information? We have gone over our time, but we are so hoping that you will take something that you have looked and said, I need to look at this resource, and that you're already kind of having some questions or thoughts churning, and that you're thinking about the agencies that you can contact that might be able to provide you with some additional resources. I have one slide left, and that is, we desperately need your feedback.
Thank you, Dr. Walker, for such a wonderful presentation. The Ohio Statewide Family Engagement Center would really benefit from your feedback on this presentation. I know they do use it for funding. So if you could please take a minute and just scan this QR code. You can also find the link on this website page. Please just take a little bit to take this survey and give your feedback about what you thought about this presentation. And thank you so much, Dr. Walker, for all of your time and efforts and giving us all of these wonderful resources.